We believe that the highest quality form of care is actually the cheapest form of care. And the reason why is because when you access high quality care, that fixes your problem, you are recovered, and then you don't need any other additional surgeries, injections, opioids, and all that stuff, right? Change the billing model, and you will change the incentives, and that has an interesting impact in terms of how healthcare operates. We need more talented folks in healthcare. Don't go and build a FinTech company. Don't go and build an AI company telling sales folks how to sell and to send cold emails. Come to healthcare because in the end, you can really get to generational wealth and you are doing something that you are proud of.
Hi, it's Chrissy, back for another very special episode of Lifers, the Second Opinion podcast, about all the crazy people that continue to try to innovate in healthcare despite how hard it is. And I have an amazing guest today with me here in the studio. He's known as V now, CEO of Sword Health, and he's joining me from his home base in Portugal. He's one of the few digital health CEOs that started the business in Europe and stayed in Europe. So I want to talk to him about that, as well as so many other topics. He and I have a very fun text friendship where we chit chat about everything going on in the world. And he's always very insightful beyond what Sword is doing, just about the industry at large. So I'm going to kick things off, V, just by asking you to introduce yourself and tell us about how you ended up in the US healthcare market as a kid who grew up in Portugal. And, it's funny to see kind of a Brit, and I grew up in London, you grew up in Portugal, and here we are in US healthcare. So tell me a little bit about just how you ended up in the space.
Thank you, Chrissy, for the invitation to be here. It's a pleasure. Yeah, it's definitely a non-traditional path, that's for sure. So when I started, I just wanted to solve a problem. I wasn't focused on I'm going to develop this product with this pricing model to sell in this specific market. I was just focused on solving the problem of how we bring people back to life, how we recover, how we treat, how we heal people. And that's why basically I started developing the technology behind what SWOT is right now, doing my PhD in electrical engineering. And then after my PhD, we just spent 4 years in the lab, just developing the technology, getting the clinical validation done and all of that stuff. And then when we decided to launch in the market, we realized that in terms of go-to-market, the US healthcare market is the most important one because, as you know, if you try to sell a solution within Europe, first, it's a market that is very risk-averse, right? And so the US market is much more eager to adopt new innovations, and they show much more willingly to do that. And then on top of that, the European market is very fragmented, as in you develop a go-to-market to France, then you go to the UK and it's completely different. And then you go to Germany and it's completely different. So you are always reinventing the wheel in your go-to-market, where in the US, when you find the product market fit, then you can expand meaningfully. And so that's why we decided that our go-to-market started with the US, and we were blessed to be successful right from the start.
I have an au pair right now who's living with us from Italy, and she's terrified to ever engage with the US healthcare system because, au pairs don't usually have tons of extra money to go spend on healthcare. But she said to me the other day, she was like, why do you guys in America treat everything as if it's cosmetic surgery? And I was like, oh, that's an interesting point, because everything is so expensive and everything feels like it's for profit. Even when you get treatment for things that you desperately need, or you're sick or you're vulnerable, we kind of treat it the same. And so, yeah, curious how that was for you, especially, given what your company does is like try to get people to not do expensive, unnecessary things, which in this case is, surgeries, hip replacements, knee replacements, all the things that are so expensive in our system, people don't even necessarily need if they get physical therapy. So that's the arbitrage for what your business is. But it kind of speaks to this overall problem with the system, which is that everything is so expensive. And even, it's very fee for service. So procedures get recommended that aren't necessarily even needed for the patient.
It's human nature, but it's also very intrinsic to the healthcare world that incentives drives behaviors, right? So show me the incentives and I'll show you the behavior. And so when you have a fee-for-service model that rewards utilization of healthcare, guess what the healthcare world is going to drive you towards? It's going to drive you towards higher utilization, right? And the thing is, higher utilization, it's not equal to high quality care, because paradoxically, we believe that the highest quality form of care is actually the cheapest form of care. And the reason why is because when you access high quality care, that fixes your problem, you are recovered, and then you don't need any other additional surgeries, injections, opioids, and all that stuff, right? And so by incentivizing utilization, the healthcare world is also incentivizing low quality of care, right? One of the reasons why we decided to shift the paradigm there is changing also how we price and how we bill our clients, changing from this utilization model where you get paid for the utilization of your members of your service to a model where we get paid if the member recovers, right? And that's like the most beautiful, pristine definition of value-based care. And that's, I believe, that's what needs to change in healthcare, is change the billing model, and you will change the incentives, and that has an intrinsic impact in terms of how healthcare operates.
Yes, I would agree with that. And I think there is something very depressing about the idea that like curative things here in the States, we just don't really have a business model for. We also don't really pay for prevention. So, clearly not aligned to outcomes. I was chit-chatting with a friend in FinTech the other day, and you'll get a kick out of this because he said to me, why are you so committed to this health tech space? Your area hasn't had a single exit over 10 billion, not one. And FinTech, we've had a whole bunch. Like, we're a tough category. It's not easy to sell into financial services, but you've had, huge breakout success stories like Plaid and Stripe, and you don't really have the equivalent of that in health tech. And I don't know that I had a great answer for it other than to say, yeah, I think you're right. But what do you think? We just haven't yet seen like a Plaid or a Stripe in healthcare, or do you think it's just not going to happen because there isn't really a structural opportunity in this space to have a company that big and in kind of the intersection of healthcare and tech?
Well, so my view on that is that I believe, at least my opinion, talking about second opinions, is that the majority of digital health companies are not real technology companies. And sure, they use technology, but they are still pretty much predicated on synchronous care, or where technology is playing a very small role in terms of how care is delivered. And when you see those FinTech $10 billion, $20 billion exits, those are intrinsically technology companies in terms of the gross margin, but also in terms of how technology is used across many different aspects of their business. And I don't think you still see that with digital health companies from the past, where I think they are care management companies using technology to incrementally improve how they do things, but not technology as the core driver, technology/AI as the core driver of the care delivery model. If you're going to see a 10, 20, $50 billion company in healthcare, in health tech, it's going to be one of those companies.
Okay, so I'm going to ask you a spicy question then. So you've got a big competitor. We all know it's Hinge, and this is a publicly traded company now that the public markets have said is probably worth about, 4 or 5 billion maybe. And we'll see how things go over time. Like if the company can continue to sustain growth and grow into some new areas like Medicare and elsewhere. But that's about kind of what the market says that Hinge is worth, maybe a little bit less depending on the week. But do you think that when you think about the public markets and you think about how your business will be valued, do you have a view that like you're fundamentally worth a lot more? Or do you think it's sort of, how do you kind of size the business up against the big competitor in the room?
Well, without throwing shade at our competitor, right, I would say that we have a much higher multiple on our revenue. And again, this multiple comes from tier one investors that know what they are doing. And why we have such a higher multiple is because AI, it's a core intrinsic thing in terms of how we deliver care. One. Second, we actually have AI that is built by us, and we are not just a software company hooking up to OpenAI or to Anthropic and using their APIs. Because, by the way, those are not AI companies. Those are software companies using an API from an AI company. And so it's a very important distinction. We train our clinical foundational models. And third, our vision is to really make access to high quality of care as accessible as running water through AI. And we already showcased that we expect to do that, not just in physical pain, not just in women's health, not just in mental health, but across all the areas in terms of care delivery. And so I think we bring a very different vision and ambition, right? Audacity is important for investors. And second, it's really about, are you really an AI company? Are you a software company using APIs from other AI companies? And so our investors are very savvy. They probe for all of those things, and then they decide that we should have a premium multiple. I tend to agree with them, but I'm biased. So I will let at decide.
It'll be really fascinating to follow. So, you and I both know the PHTI, Peterson Health Technology Institute reports well. We've talked a bunch about them. And I think what I like about these reports is they look at the evidence and the outcomes across the digital health industry, and the group that puts them together has no profit motive. So it's generally quite trustworthy. Your company did quite well within those reports. But the other thing that I think is noticeable with it, if you look at all the reports that group has done, your category also does well. When you compare it to, say, the diabetes, hypertension, cardiovascular area, the whole category of musculoskeletal fares generally better, and not just SWORD, but the competition as well. And so is there something special about kind of this area of what you call physical pain, where, you can actually do a lot with showing outcomes and ROI very clearly? Because if you keep somebody from an expensive surgery they don't need, boom, like success, right? Whereas like something like diabetes and cardiovascular is just, it's much harder to engage people. It's much harder to show the measurable outcome. And so how do you think about that as you consider kind of where to expand the business and where to apply AI with other areas outside of MSK, which is where you started, and I would say is like an area where, I think it's a little bit, I don't want to say easier, but clearer how to show ROI.
So I would say that what's special about the MSK space is that SWORD is in it. As in, SWORD was basically the tide that lifted all boats in that study. And by the way, there's public statements from the Peterson Health Institute where like SWORD has like extensive clinical validations and extensive third-party ROI studies that showcase value proposition, right? And so by SWORD showcasing that it's possible to achieve those levels of economic impact and clinical outcomes, that basically demonstrated that the space is viable. And when you ask me, what about mental health? Well, the Peterson Health Institute report on mental health was not positive, as you know, right? But I expect that with our mental health solution, we showcase that actually there's a way to develop a mental health solution that really delivers clinical outcomes and has a economic impact to client. And so I really don't think it's about the space. I really think it's about the companies in the space and how they do things, not specifically talking about any specific company.
Hey everyone, we'll get right back to the conversation after a word from our sponsors.
This episode of Lifers is brought to you by Arbiter, the care orchestration platform. Let's be honest, our healthcare system doesn't really work as one. It's full of silos, the data, the tools, and the people who use them aren't connected, and that disconnect slows everything down. That's why referrals get lost and prior authorizations take forever. Backed by one of the largest early funding rounds in health tech history, Arbiter brings payers, providers, and patients together on one intelligent platform. The result? Less patient drop-off and faster access to care. Arbiter's record action alignment model starts by creating one real-time source of truth that pulls in clinical, policy, financial, and operational data. Then it turns that insight into action, routing referrals to the best in-network option, handling authorizations and outreach, and coordinating appointments. Finally, it closes the loop so care actually moves forward. Bottom line, Arbiter helps deliver the right care in the right place, the right time, Learn more at arbiter.ai. So you're obviously very bullish on AI as like a mechanism to deliver on ROI and outcomes. Do you see any shortcomings with AI? Do you see any areas where AI will just not be able to move the needle? Because I would still push back and say I think AI makes more sense. Like with something like a physical therapy and delivering that through AI, to me, that makes a lot of sense. But then there are other, if you point to other conditions like pregnancy, for instance, like I don't see it quite as clearly where AI can have that impact. So what's your rubric for thinking about where can I use AI and where can I not use AI?
I agree with you, Chris. It's not like that silver bullet that is a solution for everything, right? And hardly you have anything like that in healthcare. I think when we think about AI, we think about how care is delivered in that specific vertical, right? Is it a care vertical that requires manual intervention? Okay. If it's required, then it's not a use case for AI. But if it's a care model where it's, for example, mental health, where it's predicated on talk therapy. Well, actually, that modality, it's an excellent modality for LLMs, so that works. Or if it's physical therapy, where the gold standard of care is patient performing therapeutic exercises, where the physical therapist is analyzing the movement of the patient and providing feedback. Well, that's actually a modality that is very good to be replicated with AI. So it really comes down to how care is delivered and the treatment process is executed. Another exception where we don't believe AI will have an immediate impact, at least in the care delivery side of things, is cancer, right? Which is again, chemo and radio.
AI is not going to eradicate cancer. Yeah.
It's not as one size fits all, but I would say that when you think about the most important conditions, the most important verticals, AI can really have massive impact on those areas. And we are seeing that right now.
Yeah. So one of the things that I think will be really interesting to watch with AI in healthcare is I think it's going to force this conversation around physician-provider quality because, we have not as a society been comfortable with that question. And anytime there's been an attempt to put numbers behind this, put data behind this, and really showcase who the best of the best are within their specialty focus areas, there's some kind of pushback like, oh, the data's wrong. Oh, this person treats more complex patients. But not every physician can graduate from the top of their class. And we know that it must be true that some are better than others. So how do you think that's going to play out with just, AI really showing that there's a potential here, I think, to level the playing field a lot more if it's trained based off of some of the best and then applied to support the physicians that maybe, or clinicians writ large that maybe are not the best of the best. And how do you think ego kind of plays into this?
I think actually it was Jensen, the CEO of NVIDIA, that said this regarding employees, but is also applicable to healthcare companies. Basically, he said that AI is not going to replace people. People using AI are going to replace people. And you can have all the ego in the world. But if you are a healthcare institution, a provider that uses AI and meaningfully provides much higher level of access and much higher levels of clinical outcomes than another company that doesn't use AI in terms of how to provide care, then you're going to lose, right? And because ego in the end doesn't save you from patients selecting another way of getting treated and getting healed. And so I think that's why, by the way, I love competition, right? I love our competitors. When we get into a new space like mental health, we get a new group of competitors because that really pushes to be better. And that's why we launched the outcomes pricing model. As in, hey, if everyone in this space is saying that they deliver really good levels of clinical outcomes, then let's all of us get paid by getting the delivery of those clinical outcomes. And Sword is still the only company doing that, right? And so it's really about put your money where your mouth is. And in the end, you can have all the ego, you can have all the narratives, you can have all the opinions in the world. If you meaningfully treat patients better, you win. And maybe you don't win in the short term, by the way, but in the long term, you definitely win.
Yeah, I like that outcomes-based pricing approach. And I am starting to see glimmers of it more and more. I think definitely your company was among the first to do it, but it works when you really align everybody. Like you can't just be doing it on your own. You have to have the employer agreeing that they will get the word out to their members, to their employees, that this benefit exists, and consistently kind of deliver upon the marketing and the messages to get the word out. Otherwise, you can't deliver on the outcomes that you're promising. So I think I like it because it aligns everybody. I mean, just getting on board with, the fact that we have to make people aware of the benefits existence. That is definitely one of the big problems with the whole space in general, that you just see very, very low rates of utilization because of the way that these contracts used to get done, where it really didn't matter that much if anybody used some of these benefits or not. So I love to see that kind of evolution in digital health. But I want to ask you a question about the competition. And you mentioned mental health as an area that you've moved into with Sword Mind. But I wonder if are you a build guy, a buy guy, or are you flexible about kind of the build or buy as you think about kind of expansion and you look across the market? And I'd love to hear your reasoning.
Yeah. So first and foremost, we are a build kind of company. We like to build our solutions, and that's what we've always done. We thrive, we bloom, we move, with Mind. We are building those solutions from scratch, and because we believe that, we have these criteria and these guardrails, so we like to build solutions our way. This being said, we are opportunistic in acquiring companies, and we did some acquisitions. We are actually working on some big ones, but it's all hardly because of the product, because of the solution. It's either because of the team or the book of business or the channels, hardly because of the product.
I'm excited to see what you do in the next couple of months. V, I want to shift topics a little bit and ask you where you are sitting right now, like geographically.
I'm in sunny Porto.
So, okay, I love it. You're a little bit of a trendsetter for me because most companies that start in Europe, the CEO ends up in America if they are ultimately targeting the US market. I think you're the only one that I know that has stayed in Europe and has success commercially in the US. So tell us a little bit about how you were able to pull that off. And then also, do you have to do crazy things like be working until 10 p.m. at night because of the time zone differences?
Yes. So how I pull this off? When we raised and I told this story a couple of times already. When we raised our Series A from Causal Ventures, it was actually a requirement for me and my co-founder, Marcio, to move to San Francisco with our families, right? This was 2019. And by then we were this company trying to get into the US. Safe to say that we didn't have any hype at all behind us. It was the only term sheet that we had. And by then I already tried to get to raise from all the European investors, and other European investors told me no. So this term sheet from Causal Ventures was the only possibility for us to raise money. And it had a condition, that condition of like, we need to move with our families to San Francisco. And obviously, since I had no choice, I said yes, but I had zero intentions, honestly, to do that. And my mental model by then was, look, either this goes very, very well, and it doesn't matter where we are, or it actually doesn't work. And it also doesn't matter where I am. So in this analysis, it never mattered where I was, because either this works very, very well, and it's not like they're going to fire me just because I'm in another country, or this doesn't work, and it's not like they are going to put another $5 million in the company just because I'm in San Francisco, right? So it's like, my only focus was, let's make sure this works and that we are successful. And I'm a product-centric CEO, so my belief is that if we have the best product, if we have the best value proposition in the market, then I don't need to be talking to new clients and meeting face-to-face all the time, because the product will do the talking. And that's my view of how to build a company. And so I just decided to focus on being in the trenches with the product, the clinical engineering teams, to build a great product. We were successful at that. And then it stopped being a topic of discussion because like, hey, somehow this is working. And this works for me because given the difference in time zone, I have the mornings to myself because the US is at sleep. So I just like do deep work. I can do deep work because like I have no distractions. I don't have calls. So that's very, very important. Then around 2 p.m. my time, New York starts waking up and then I start having calls. And then I do a break at 6 p.m. And from 6 p.m. to 9 p.m., I'm just with my kids. And then from 9 p.m., I start working a little bit until 10, 11 p.m. And it's a model that's been working for me. One thing that I also really like is that I'm outside of the bubble. I never drink the startup Kool-Aid. I never go into all of get into all of these new fashions. And we have this set of first principle approach to how we do things because we are really outside of the bubble. And I like to be outside of the bubble because I think it allows us to see in a much more truthful way how things are. And so, yeah, for us, it works, but I think we have our idiosyncrasies as a company that allows us to be able to do that.
Yeah. So speaking of the zeitgeist and the cultural moment, I mean, I do think that there was a period of time where it felt like we were basically saying we want startups to be more inclusive and we want to make it possible for people with families and other responsibilities to work at startups. And so let's be flexible. And then the pandemic happened and people became very flexible and started kind of coming up with and devising schedules, a little bit like the one that you have, that worked for them because they had kids and responsibilities and they cared about having a balance. And now it feels like we're back with the vengeance around the idea that like startup employees should be athletes. And if you don't want to work basically 24/7, don't bother even like coming to work at my startup office 5 days a week. Everything needs to be done back in person. And it seems like it's sort of flipped in the other direction. Where do you land on all this? What's your view of how to get the most of people? And because you're a father and you want to spend time with your own kids, how has that impacted your way of thinking about employees that also have those responsibilities?
Yeah, we believe in true empowerment. And so if you want to go to one of our offices every single day, perfect, I do that. But then again, I drop my kids at school every single day. So it's like I just go to the office. If you want to stay at home every single day and work from home, that's also okay. If you want to come 2-3 days to the office per week, that's also okay. I think it's a little bit, honestly, moronic, this thing that we are extrapolating the number of hours worked as a synonymous of quality of the work. And I think that those are two different things. And I see that myself. Sometimes I'm like 10 hours at work in a single day and the output of that is minimal. Sometimes I work 1 hour and I have couple of great ideas and like the day is done. And so I think number of hours worked, it's not the same thing as the output or productivity. Those are two different things. And especially in our space, when you are talking about innovation, when you're talking about creating things, one of the reasons why I never moved to the US is because for me to create and to invent and to build, I need to be at peace in order to really feel creative. And for me, that's being here in Portugal, right? And so I could be somewhere else and working 12 hours per day, and my output, I'm sure, will not be the same as if I'm here working 6 hours per day, because here I'll be fully capable. And so that's why we believe into empowerment in the sense that you do you define what makes more sense to you, and you adapt that to your own schedule, right? For me, that's my schedule. It works together beautiful, right? For someone else without kids, maybe it's a different schedule. And as long as you have an output, as you are contributing, as you are building, I'm completely okay with it. Your question about how being a father changed my perception. Honestly, before I had this perception, and I'm being very honest about this, which is I thought, oh, when you're a father, your bandwidth is really limited. And so also your output will be limited. And what I've realized is I've never been more successful, more productive, more creative now that I have 2 kids than when I had no kids, which I find it super interesting.
Yeah, I would agree with that. As somebody who also has 2 kids, and they're young kids, so they take a lot of time and they're always sick. And, sometimes it feels like a miracle that I even have the day. But I feel like now I just like cut to the chase. I'm like, I don't have time to sit around contemplating all the bad things that could happen and all the politics. I've just become extremely assertive, and it's so refreshing. And I also just don't feel bad anymore about saying, these are the things that I need. Like, if you want me to do this thing that means time away from my kids, this is the set of requirements. And, I'm not running around doing tons of stuff now to feel relevant or to feel like people want to hear what I have to say. I'm just like, I don't have time anymore. And so to me, it's made me way more productive. I'm curious if you feel that way too, that you just cut to the chase.
Then since you don't have time, and as you pointed out, Chrissy, quite well, it's not as much you don't have time is if I'm spending time with these, I'm not spending time with my kids, right? So it's like I always compare it directly. And since I'm a father, I'm always looking for ways to be more efficient, right? Where before, since I had all of this free time, I was like, yeah, I have time to do that. And when you start looking at all of the things that you do and look at that to the efficiency lens, you become much more efficient at everything. And you find you are always devising systems and processes to make sure that you are much more efficient. And then, funny enough, the company, because the CEO is a reflection of the company and the company a reflection of the CEO, the company itself becomes much more efficient in the process. And so something that was quite surprising to me, 2x more productive now than I was before without kids.
I love that. And I think that needs to be out there a little bit more in kind of the startup vernacular. So last question for you. So I feel like I've known a lot of people who've gone to work at Sword, and, it's sort of known in the industry as having like a little bit of a culture of like, if you fit in, then you can do very well. Like I've had friends that have been promoted in a month because they just come, they're really good at what they do. They're sort of noticed as being kind of a real kind of up and comer and a culture fit, and boom. And likewise, I've known people who've gone into your business and cycled out pretty quickly because they just did not fit in. So how do you define like what makes a Sword employee successful, and what are you looking for to just like, where it's immediately for you, it's like, boom, like that is talent that I need to nurture. Like, what are the qualities that you see in people?
Yeah, honestly, we are still trying to distill that into a set of characteristics. And it's very hard because I see some folks that were very, very successful and some other folks that were also very, very successful. And if you compare them, you will say they have nothing in common, right? And so we are still trying to distill that in a set of variables that we can optimize for. I think in the end, if you are successful at Sword, is because you don't see it either like, this is my work, this is my life. You see this as the intertwine of like, this is my passion. I really want to solve this problem, right? And then you match that with being creative, having a big sense of urgency, and then you will be successful at Sword because that's how we operate. When people usually don't work, it's because they miss one of those things, right? And honestly, that's on us because we need to do a much better job analyzing that before the person joins so that we are not wasting anyone's time. But yeah, I think it's really, you need to have really a big sense of purpose, a big passion to solve this, and being creative, being humble. Sometimes we see folks that playing that political game and like that just doesn't work at Sword because we are very transparent. You need to be honestly very comfortable with confrontation and with feedback because we believe, and this is one of our internal sayings, that from dissent comes discovery, right? And so we believe that it happens across all ranks in a bi-directional way. We can have a junior person telling me that I don't agree with what you just said. And that's completely acceptable because we want to have that culture, right? We don't want to be in a culture where the emperor has no clothes, because I think that's when you start fading out as a company.
And I've heard about you specifically that you're like the opposite of a micromanager. You're very much like somebody who wants to just trust people that they know what they're doing and give them like license to, go get it done. Right. Am I right in thinking that?
I'm on the two opposites of that spectrum. As in, if you are doing your things right, you have a budget, go execute, be happy. And if you are not doing things right, then I'm in the trenches with you, and then I'm like the Uber micromanager.
Okay.
And in between,
So you have both modes.
I have both modes. And so some folks will look at your comment and like, no, he's a maniac in terms of micromanagement. And some other folks, no, it's actually, he leaves me alone for me to build and do stuff. And honestly, that's why I'm able to have 25 direct reports, because 20 of those are operating independently, doing their things very successfully, and 5 of them basically absorb all my time because I'm micromanaging everything with them. So yeah.
So you don't want to get on that side of you.
Look, when I'm micromanaging, I'm trying to help, right? I'm still trying to help. And some folks survive that micromanagement and become much better in the process and then become truly independent. And some folks don't survive that micromanagement. And that's also okay. But yeah, I'm on both sides of the spectrum.
Well, I super appreciate the chat. I feel like we got into so many different topics, from just culture to what it takes to succeed in digital health. Any just parting words of wisdom or advice for anybody getting their start in the space today?
We need more talented folks in healthcare. Don't go and build a FinTech company. Don't go and build an AI company telling sales folks how to sell and to send cold emails. Come to healthcare, because in the end, you can really get generational wealth in healthcare, and you are doing something that you are proud of.
I love that. Yeah, that was actually my most recent newsletter, just to give a plug for a Second Opinion newsletter. It was about that. Like, we got to invest in the world that we want to see in the future. And healthcare is hard and it's slow, but there's no way we won't get there. 17% of the GDP in America. It's huge. And it's still stuck in like the dark ages. So I think it just takes time. But if you're running away from the space now, because it takes, in your view, there's shinier objects, like I think you'll miss out.
Yeah, and it's hard, but it's rewarding. And in the end, your life will be very empty if you optimize just to be rich.
I love that. All right. I love it. Okay, well, that's a perfect note to end on. So thanks so much for joining me.
Thank you for the invitation. It was super cool.
That's a wrap on Life Is. If you know someone else grinding it out in healthcare, send them this episode. And if you want more unfiltered takes on digital health, check out the Second Opinion newsletter, link in the show notes.